Hello, everyone. This is a brief 5-minute lecture skimming over the topic of unipolar depression. Throughout the lecture, you can take notes as you wish, but it is not mandatory. Given that we are in the digital age, I have attached a photo of myself to the slide, that way I'm not just a voice. These are some statistics of prevalence of depression among adults in the U.S. as of 2019, and this is taken from the National Institute of Mental Health. About 19.4 million adults had at least one major episode of depression. It was more prevalent in adult females than it was in adult males. Also, adults of ages 18 to 25 reported the highest number of depressive episodes, which would make sense considering that this is about the age people go to college and try to figure out their future. Here is a list of symptoms taken from the DSM-5, which is the Diagnostic and Statistical Manual for Depressive Disorders. It is very important to remember that not every single symptom is necessary to be diagnosed with unipolar depression, and that every person can show symptoms in their own way. So what causes unipolar depression? There are 4 models that have their own prediction as to what causes depression. The first one we'll go over is the biological model. The biological model believes that depression is tied into genes as well as a neurotransmitter imbalance of norepinephrine and serotonin. The second model is the psychodynamic model, which suspects that major losses result in depressive episodes. So if someone were to lose their parent or a great amount of money, then according to the psychodynamic model, they can develop depressive symptoms. The next model is the cognitive behavioral model. The cognitive behavioral model presumes that a person can develop depressive symptoms if they lack rewards or have negative thoughts of themselves, their experiences, or their future. This is known as the cognitive triad. Along with the cognitive triad is a trait of learned helplessness, which is if someone is faced with a difficult situation they have failed before, they already assume that they cannot do anything to change that. Lastly, we have the socio-cultural model that infers that the causes of depressive symptoms is a lack of support from their family or their social peers. The socio-cultural model also believes that symptoms could stem from gender, racial/ethnic, or non-Western differences. There are 3 forms of unipolar depression, and they are major, persistent, and premenstrual. Major depressive disorder is when a person has major depressive episodes but no mania or hypomania. Persistent depressive disorder is when a person has at least 2 years of mild or major depression, 2 months of nonstop symptoms, and no mania or hypomania. Also, if there is distress or impairment, such as not being able to go to work, then that would be a symptom as well. Lastly, we have premenstrual depressive disorder, which is when a woman gets depressive symptoms the week before menstruation. This disorder is questioned among some psychologists, considering it puts a name to a symptom of just being a woman. This brings us to the topic of men versus women. Like I said before, not everyone's symptoms look the same. Male symptoms can look very different compared to female symptoms, and it is important to know the difference in order to make a proper diagnosis and treatment plan. For men, their depressive symptoms can include anger attacks, substance abuse, and risky behaviors, while women's symptoms may include stress, irritability, sleep problems, and loss of interest. In order to look at treatment plan, we must go back to the 4 behavioral models. For the biological model, medications such as SSRIs and SNRIs are a form of treatment that can be used to minimize depressive symptoms. There is also electroconvulsive therapy, which involves brain stimulation. For the psychodynamic model, patients would go to therapy to identify any unconscious or underlying grief that may be causing their depressive symptoms. This could involve bringing up past losses such as significant deaths or an increase of debt and money. For cognitive therapy, therapists and clients would work together to change the way the mind works in order to increase their positive thinking and activities in life. This may include changing the patient's attitude to encourage them to act and think more positively. Lastly, for the sociocultural model, there are multiple therapies that can be designated to a specific disorder the patient is having. For example, there is interpersonal psychotherapy and couples therapy. Lastly, we just want to mention that depression is a serious disorder that should be treated. If you or someone you know is struggling with depression, here are some resources on and off campus that are available to you.